And the fourth juiciest tip that I have for you, if you want to build confidence as a nurse, is
in today's video, we're going to talk about confidence. How do you build confidence as a nurse? Stay tuned.
What's going on, family? Welcome back to A Couple Nurses. This is Cordero, your host. In today's video, we're going to give you guys 4 quick and foolproof suggestions for how you can build confidence as a nurse. You need to be confident if you're taking care of somebody's life, right? So before we get into today's content, be sure to like, share, subscribe. I try to get to all the comments, so if you leave some down the bottom, I'll probably see it and I'll probably get back with you. And if you found any value in this video, be sure to comment "Nurses Rock" down in the comment box. And last thing here, check out our podcast that Monica and I have, Code Blue and Bullshit. We talk about ICU life and the things that we learned and try to shorten that learning curve for you guys. Let's get into the content. So the very first thing that you need to know if you want to build confidence as a nurse, especially new grads, is things that are very simple. So things like posture and eye contact. So in everyday life, you don't want to be slouched out like this. You don't want to be looking down at the ground. This just shows that I'm defeated. This shows that I don't know where I'm going or what I want to do next. All right. Very simple. Straighten your back up. So instead of being like this, straight back, and then just keep your chin up. Chin up, boy. And eye contact. Eye contact is very important. So when you're passing people up in the hallway, whether it be doctor, nurse, anybody at all, just human courtesy says, look at this person, acknowledge them as a human being. Whether it's a head shake, you look at somebody like, how you doing? Or give them a head nod. But I think that it shows that you don't have as much confidence, and this could just be me, it could be subjective, is whenever you're looking at your phone, whenever you pass somebody down the hallway, you decide you want to look at your phone or you're going to look somewhere else, or like, that's weird to me that people can't look at each other and just acknowledge that they're humans, right? The next thing that you need to do if you want to build confidence as a new nurse or a nurse in general is ask questions. The last thing you want to be doing when you have someone's life in your hand is to blindly follow orders. So know, why are we doing certain interventions? Why is this patient's care plan look like this? Definitely ask the doctors on their rounds why things are happening. If the family's asking you why things are happening, you're able to give them an answer and for yourself. So that gives you confidence in whatever interventions or what you're doing for this patient. That's a lot of confidence when you know why you're doing it. But if you're just hanging different fluids that were ordered or hanging different antibiotics but don't know the reason why, that's kind of suspect, and I wouldn't trust in somebody that was doing that. So you shouldn't trust in yourself if you're blindly following orders. Ask why and know the whys behind why we're doing things as nurses. Also keep in mind that it takes a lot of confidence in general to ask why, and it takes a lot of confidence in general to say, I don't know. If you don't know, if you do say, I don't know, go find out. Don't say, I don't know, and leave it wherever it's at. Say, I don't know, and if the doctor's not there to say why we're changing fluids, go, do some research on your own, whatever that may be. But yeah, I don't know is not a good answer, and you should always follow up with trying to find out why. The third thing, and this is something I haven't done to build confidence, but I've seen it help Monica, is find a mentor. So find somebody that's where you want to be, talk with that person frequently about your problems, and hope that they can give you some constructive feedback. I don't really have any suggestions on how to find a mentor. We'll leave that video for Monica. I'll let her know so she can make a video to let you guys know how to find a nurse mentor. But yeah, that can definitely help you build confidence too, because I've seen it help her out a lot. And the fourth juiciest tip that I have for you, if you want to build confidence as a nurse, is to put yourself in difficult and uncomfortable positions and then reflect. So there's a situation early on whenever I was in the ICU is, the doctor was intubating, and I didn't know everything to give for intubation. I don't know who I need to contact. I don't know that I need to contact the RT, the respiratory therapist, as far as which meds he wanted to use, what kind of blade he wants to use. It was all these things that I didn't know my very first 1 or 2 times. But after I was in that uncomfortable position and saw how important and time critical intubating a patient is, I was able to see, I put myself in this hard, difficult situation where I didn't know what was going on. And then I found out, this is what I need to do next time that it happens so that things run a lot more smoothly. I feel a lot more confident now when my patients are getting intubated. I also was able to ask my preceptor, who was kind of helping me along the way, what could I have done better? So if you can find feedback through some of these situations, you're winning, dude. You're winning. definitely put yourself in difficult situations. That's probably the fastest track to building confidence, along with this posture thing that I'm talking about. But yeah, guys, I hope you guys enjoyed the video. We'll keep them coming. Until next time, peace out.